Business Spotlight here on WMAY, and we're talking with SIU Center for Family Medicine. Dr. Cynthia Thomas joining us here on the Business Spotlight with WMAY. I'm Greg Bishop. Doctor, thanks for taking time with us this morning and telling us what SIU Center for Family Medicine does. So what's your role with SIU CFM?
Well, thank you for having me. I serve as Associate Professor of Clinical Medicine. In that role, I have clinic responsibilities and teaching responsibilities. My clinic responsibilities include seeing patients at our 4th Street office. I've been there for 23 years, and that is our main office. And then we also have a satellite clinic that is housed inside of the Memorial Behavioral Health Center, and this is called our Integrated Wellness Clinic. And this clinic was established a few years ago through a grant from the SAMHSA organization, which is the Substance Abuse Mental Health Services Administration. And that grant fostered, the goal was to provide primary care on site at a behavioral health center so that patients with mental illness would be able to get their primary health care needs. So I go to both of those clinics and see patients. And then I also teach, which is mainly supervising, so kind of on-the-job training for our residents, mentoring those resident physicians, but also seeing medical students and teaching them. Sometimes it's more of in a classroom setting, but usually it's more shadowing in clinic and giving kind of that on-the-job, day-to-day training.
Dr. Cynthia Thomas joining us here on the Business Spotlight with WMAY and highlighting the things that the SIU Center for Family Medicine does. Of course, in your capacity, you teach and train some of the heroes in healthcare that are going to be helping families out. But tell us what the Center for Family Medicine focuses on when it comes to family medicine.
I'll just start off by saying that we are a federally qualified health center. We are a community-based residency program that is affiliated with SIU School of Medicine, and then we're a patient-centered medical home. By being a federally qualified health center, that allows us to provide services to patients with a sliding fee scale. So we are able to provide care to patients regardless of their ability to pay. We have patients who are on Medicaid, who are on Medicare. We have some patients who are uninsured. And so having that designation has allowed us to really increase the services that we are able to provide for our patients. We're a community-based residency program. We have at least 30 residents of first, second, and third year, and we have a standalone center, which attracts a lot of residents to our program. We're actually in the midst of interviewing season towards the end of it, and they get excited seeing that they can have rotations where they are the only resident present, but also they get the resources of the affiliation with SIU School of Medicine. So they do have the specialists around. They have residents and other residencies who are present as well to enhance their learning experience.
I know so many families that are impacted by the great work that you guys do there at the Center for Family Medicine with SIU. We're talking with Dr. Cynthia Thomas here on the WMAY Business Spotlight. What are some of those things that the Center for Family Medicine offers, the services that are offered?
Oh, wow. I'm so excited about this because I've just seen this grown since my years being here. Not only do the patients get to have a primary care physician, the patient and that physician can see patients of all ages, from babies to grandparents. There is the sliding fee scale, as I mentioned earlier. Patients can also receive their obstetrical care, including care from midwives, which is appealing to a number of patients. We can provide full spectrum care that includes those physicals, and I will just say it's not too early to get those school physicals in. It can include yearly wellness visits for adults and children. It includes the chronic disease management. What that means is the high blood pressure, the diabetes, the asthma management. That can be done by a primary care physician who is familiar with your case. We offer procedures in women's health, removing skin lesions, joint injections, of steroids, et cetera. And one thing that we've been able to provide is specialty care. Some patients are comfortable with our center. It's home for them. And yet when they have to go to other offices, they're uncomfortable. So we have a few specialists who actually come and have clinics in our building so that patients can receive care from a cardiologist or a back and neck specialist in our center. We have nutrition counseling, and I know we're kind of beginning a new year, and a lot of people have weight loss goals. We have nutrition counselors who not only help with weight loss, but they're also diabetes educators who can help with those nutrition skills and management skills for diabetes. We have a weight management clinic that is staffed by a physician and an advanced practice nurse, in addition to nutritionists and behavioralists. We offer integrative medicine services, and that includes Asian medicine practices such as acupuncture for patients who are suffering from substance abuse, such as opioid addiction, which has been a big problem lately. We have a medically assisted treatment clinic that is housed by family doctors who have a special interest in that, in addition to nurses and behavioralists. And then we have behavioral health services. So if you're suffering from depression or anxiety, we have therapists on site at the clinic who will actually come in and assess you. We call them integrated care professionals, and they help to give that on-site assessment and can help facilitate, if needed, the patient getting in to see a psychiatrist. Last but not least, we do have a geriatric clinic, and we do home visits for patients who are homebound and can't make it into the center. And so, as I said, I'm very excited about all the services and the resources that we are able to offer our patients.
Dr. Cynthia Thomas joins us with SIU Center for Family Medicine, and as you just heard, it is a whole family approach. They're looking at every aspect of you and your family's lives and making you and your family healthier and better moving into the new year. Doctor, how can families find out more if they can take part in some of the services that SIU Center for Family Medicine offers? Great
question. Our address is 520 North 4th Street. We're right on the corner of 4th and Carpenter. So if you don't have a telephone, you can definitely pop in and someone can help you. I would call 217-545-8000 or check out SIUmed.edu.
SIUmed.edu, or you can...
Let's do .org, SIUmed.org.
Gotcha, .org. Yeah. Definitely want to make sure that that's clear. SIUmed.org, or you can call 217-545-8000. Dr. Cynthia Thomas with SIU Center for Family Medicine. Great to hear all the wonderful services you're providing to keep our community healthy. And we'll talk again soon, all right?
All right. Thank you.
This is the Business Spotlight on WMAY.